hyperkalemia. Question 21. Mang Teban has a history of chronic obstructive pulmonary disease and has the following arterial blood gas results: partial pressure of oxygen, PO2, 55 mm Hg, and partial pressure of carbon dioxide, PO2, 60 mm Hg. When attempting to improve the client's blood gas values through improved ventilation and oxygen therapy, which is the client's primary stimulus for breathing? A. HyPO2. B. Low PO2. C. Normal pH. D. Normal bicarbonate, CO3. Question 21. Answer: B. Low PO2. Question 21. Explanation: a chronically elevated PO2 level, above 50 mm Hg, is associated with inadequate response of the respiratory center to plasma carbon dioxide. The major stimulus to breathing then becomes hypoxia, low PO2. HyPO2 and normal pH and CO3 levels would not be the primary stimuli for breathing in this client. Question 22. A client with very dry mouth, skin and mucous membranes is diagnosed of having dehydration. Which intervention should the nurse perform when caring for a client diagnosed with fluid volume deficit? A. Assessing urinary intake and output. B. Obtaining the client's weight weekly at different times of the day. C. Monitoring arterial blood gas, ABG, results. D. Maintaining IV therapy at the keep vein open rate. Question 22. Answer: assessing urinary intake and output. Question 22. Explanation: for the client with fluid volume deficit, assessing the client's urine output, using a urometer if necessary, is essential to ensure an output of at least 30 ml/hour. The client should be weighed daily, not weekly, and at same time each day, usually in the morning. Monitoring ABGs is not necessary for this client. Rather, serum electrolyte levels would most likely be evaluated. The client also would have an IV rate at least 75 ml/hour, if not higher, to correct the fluid volume deficit. Question 23. Which client situation requires the nurse to discuss the importance of avoiding foods high in potassium? A. 14-year-old Elena who is taking diuretics. B. 16-year-old John Joseph with ileostomy. C. 16-year-old Gabriel with metabolic acidosis. D. 18-year-old Albert who has renal disease. Question 23. Answer: D. 18-year-old Albert who has renal disease. Question 23. Explanation: clients with renal disease are predisposed to hyperkalemia and should avoid foods high in potassium. Clients receiving diuretics, with ileostomies, or with metabolic acidosis may be hypokalemic and should be encouraged to eat foods high in potassium. Question 24. Genevieve is diagnosed with hypomansemia. Which nursing intervention would be appropriate? A. Instituting seizure precaution to prevent injury. B. Instructing the client on the importance of preventing infection. C. Avoiding the use of tight tourniquet when drawing blood. D. Teaching the client the importance of early ambulation. Question 24. Answer: A. Instituting seizure precaution to prevent injury. Question 24. Explanation: instituting seizure precaution is an appropriate intervention, because the client with hypomansemia is at risk for seizures. Hypophosphatemia may produce changes in granulocytes, which would require the nurse to instruct the client about measures to prevent infection. Avoiding the use of a tight tourniquet when drawing blood helps prevent pseudo-hyperkalemia. Early ambulation is recommended to reduce calcium loss from bones during hospitalization. Question 25. Which electrolyte would the nurse identify as the major electrolyte responsible for determining the concentration of the extracellular fluid? A. Potassium. B. Phosphate. C. Chloride. D. Sodium. Question 25. Answer: D. Sodium. Question 25. Explanation: sodium is the electrolyte whose level is the primary determinant of the extracellular fluid concentration. Sodium, a cation, for example, positively charged ion, is the major electrolyte in extracellular fluid. Chloride, an anion, for example, negatively charged ion, is also present in extracellular fluid, but to a lesser extent. Potassium, a cation, and phosphate, an anion, are the major electrolytes in the intracellular fluid. Question 26. John has a potassium level of 6.5 mg/L. Which medication would Nurse Wilma anticipate? A. Potassium supplements. B. Kayexalate. C. Calcium gluconate. D. Sodium tablets. Question 26. Answer: B. Kayexalate. Question 26. Explanation: the client's potassium level is elevated, therefore, Kayexalate would be ordered to help reduce the potassium level. Kayexalate is a cation-exchange resin, which can be given orally, by nasogastric tube, or by retention enema. Potassium is drawn from the bowel and excreted through the feces. Because the client's potassium level is already elevated, potassium supplements would not be given. Neither calcium gluconate nor sodium tablets would address the client's elevated potassium level. Question 27. Which clinical manifestation would lead the nurse to suspect that a client is experiencing hyperkalemia? A. Muscle pain and acute rhabdomyolysis. B. Hot, flushed skin and diaphoresis. C. Soft tissue calcification and hyperkalemia. D. Increased respiratory rate and depth. Question 27. Answer: B. Hot, flushed skin and diaphoresis. Question 27. Explanation: hyperkalemia is manifested by hot, flushed skin and diaphoresis. The client also may exhibit hypotension, lethargy, drowsiness, and absent deep tendon reflexes. Muscle pain and acute rhabdomyolysis are indicative of hypophosphatemia. Soft tissue calcification and hyperkalemia are indicative of hyperphosphatemia. Increased respiratory rate and depth are associated with metabolic acidosis. Question 28. Joshua is receiving furosemide and digoxin. Which laboratory data would be the most important to assess in planning the care for the client? A. Sodium level. B. Magnesium level. C. Potassium level. D. Calcium level. Question 28. Answer: C. Potassium level. Question 28. Explanation: diuretics such as furosemide may deplete serum potassium, leading to hypokalemia. When the client is also taking digoxin, the subsequent hypokalemia may potentiate the action of digoxin, placing the client at risk for digoxin toxicity. Diuretic therapy may lead to the loss of other electrolytes such as sodium, but the loss of potassium in association with digoxin therapy is most important. Hypokalemia is usually associated with inadequate vitamin D intake or synthesis, renal failure, or use of drugs, such as aminoglycosides and corticosteroids. Hypokalemia generally is associated with poor nutrition, alcoholism, and excessive GI or renal losses, not diuretic therapy. Question 29. Mr. Salcedo has the following arterial blood gas, ABG, values: pH of 7.34, partial pressure of arterial oxygen of 80 mm Hg, partial pressure of arterial carbon dioxide of 49 mm Hg, and a bicarbonate level of 24 mg/L. Based on these results, which intervention should the nurse implement? A. Instructing the client to breathe slowly into a paper bag. B. Administering low-flow oxygen. C. Encouraging the client to cough and deep breathe. D. Nothing, because these ABG values are within normal limits. Question 29. Answer: C. Encouraging the client to cough and deep breathe. Question 29. Explanation: the ABG results indicate respiratory acidosis requiring improved ventilation and increased oxygen to the lungs. Coughing and deep breathing can accomplish this. The nurse would administer high oxygen levels because the client does not have chronic obstructive pulmonary disease. Breathing into a paper bag is appropriate for a client hyperventilating and experiencing respiratory alkalosis. Some action is necessary, because the ABG results are not within normal limits. Question 30. A client is diagnosed with metabolic acidosis. Which would the nurse expect the healthcare provider to order? A. Potassium. B. Sodium bicarbonate. C. Serum sodium level. D. Bronchodilator. Question 30. Answer: B. Sodium bicarbonate. Question 30 Explanation. Metabolic acidosis results from excessive absorption or retention of acid or excessive excretion of bicarbonate. A base is needed. Sodium bicarbonate is a base and is used to treat documented metabolic acidosis. Potassium, serum sodium determinations, and a bronchodilator would be inappropriate orders for this client.